Lake Cumberland is a regional hospital, which means we service our local area, which is many counties. It's between a lot of big cities, but it's not close to any of them. So we service a community of close to 200,000 people that don't have ready access to Lexington, Nashville, Knoxville, Louisville, Bowling Green, Cincinnati. We're kind of in the middle of all of that. We have a new state-of-the-art Cath Lab here at Lake Cumberland. It's as good as anywhere in the country. We are centrally located close to a lot of small hospitals that don't have the facilities that we have to take care of cardiac patients, especially those that need a heart catheterization or the ones that are having an MI or non-STEMI MI. We have 3 cath labs, and we have plenty of physicians here and staff so that we can get those patients taken care of in a very timely manner. Less x-ray exposure, which is safer for the staff, the physician, and the patient. And we do it with higher efficiency, which is just good all-around sense. The new equipment, as with the new car, comes with new technology. So we get really good images out of the box when we first start, because the system evaluates, when it goes through the patient, it evaluates how much it needs to get the image that we are looking for. We don't have to adjust it and redo it. So the image quality is just stellar, which makes all the difference in the world when we're trying to see what we're doing with your heart or your legs or any other part of your vascular anatomy.
When a patient is having chest pain and calls 911, the EMS arrives to that patient, and they then do an EKG. If they determine that the patient is having a STEMI, the EKG is then transmitted to Lake Cumberland Regional Hospital. At that point, our Cath Lab team is activated. Our Cath Lab team consists of 2 registered nurses, a radiology tech, and our monitor. When the patient arrives, they are moved over to the table, and the cardiac catheterization then begins.
If a patient is brought in emergency, it is due to an MI, which we like to refer to as ST elevation myocardial infarction. After the patient is rushed into the cath lab, the cardiologist meets us here, where we then perform an angiogram so that they can localize the culprit vessel that's causing the MI. So being a chest pain accredited center, the goal is so that we restore blood flow within a benchmark that we shoot for of 90 minutes so that we can reduce the risk of muscle damage. Our average here at Lake Cumberland Regional Hospital is 45 minutes, with our best being 8 minutes.
We pride ourselves on being one of the fastest door-to-balloon times, not just in Kentucky, but in the nation. We rank as high as any place that you can possibly go. And the reason for that is we have excellent staff. We are just down the hall from the emergency room, which means we're well placed. We have equipment that comes up quickly. We can see what we're doing, exactly what we need to do. This is a state-of-the-art cath lab, but it's only one of 3 that we have. So when we get someone in the emergency room, the whole process is put on hyperdrive, and we do a very good job of getting them here. And it's all about saving heart muscle, because that's what affects long-term the patient's outcome, their sense of well-being, and their future health.
I think the thing that sets us apart is the teamwork and the willingness of our staff to do whatever it takes to make sure our patients and our community is taken care of.